This is the podcast overview for the objectives for Chapter 14, Heart Disease, Stroke, Cancer, and AIDS. So you'll begin the chapter by identifying key aspects of coronary heart disease. So this would be, what are the different types of coronary heart disease are there? What are the typical symptoms? Who is at risk? And what's the prevalence? Meaning, how many people get heart disease, at what rates, men versus women, and basically all the statistics. Then you'll explain the relationship between negative emotions and heart disease. What is the link there between our negative emotions like anger, bitterness, resentment, and its ties to heart disease? Then explain what is involved in medical treatment and rehab of cardiac patients. So if I'm a patient recovering from a heart attack, what kind of rehab would I be going through? What kinds of treatments would I be receiving? And what is effective? So for an effective cardiac treatment program, what would be the key components? Then also understand the psychosocial impact of heart disease on the individual's family and work. There's the physical hardship of having a heart attack and recovering, and then living with heart disease. But there's also a lot of psychosocial elements like changes in one's role in the family system, maybe leaving a job, or having to take a different kind of job as a result of the illness and its limitations on one's body physically and mentally. And then just, it can be hard on the family because it's a hard disease to navigate. Requires a lot of change at a late stage in life where people are pretty set in their routines. Then next, identify key aspects of stroke. So we're going to move into talking about stroke. Who is at risk for stroke? What are the causes of it? How does one have a stroke? What happens when you have a stroke? What are the symptoms, early symptoms even, that you could tell? And then what might be some of the biological and lifestyle factors related to stroke? So what kinds of things put us more at risk for having a stroke? And these could be things that are heredity, and in our DNA, or these could be things that have to do with how we're living, our eating habits, exercise, stress levels, and so forth. You want to understand the various impairments that occur with stroke victims. So when a person suffers a stroke, what then is the result? How are they after? And what are some common coping strategies that people use with stroke? As well as the emotional, occupational, and social effects of stroke. Oftentimes a stroke leaves people very debilitated. Oftentimes they lose language or parts of language. They lose the ability to speak or understand. They might lose the ability to write, tie their shoes, get dressed by themselves, walk. So a lot of it is relearning some of those basic things. So with that comes a very big loss of independence and loss of ability to communicate. So this can be really tough on the patient and his or her family members. Describe the prevalence and types of cancer. So now we'll move into talking about cancer. What are the various types of it? How common are they? And explain the common cancer sites and how prevalent each type is. So we're talking about, when we say cancer sites, we're talking about places on the body. So like skin cancer, brain cancer, lung cancer, pancreatic cancer, and so forth. What is the prognosis of cancer? So if I am diagnosed with cancer, what can I expect to happen? What might be my outcome? And how does age, gender, and sociocultural factors play a role in that? We typically think of the acronym CAUTION when diagnosing and recognizing cancer. So you'll want to get familiar with that acronym. As well, be familiar with the most common tools that medical professionals use for diagnosing cancer, as well as some more of the cutting edge research in cancer diagnosis. It explained the various routes of treatment for cancer. Not all cancers are treated the same, but there are some common threads, like chemotherapy and radiation therapy, as well as psychotherapy to handle the changes that are occurring for a person going through cancer treatment. Be familiar with the side effects of cancer treatment and the psychosocial impact of it. And that might include anything from the decisions one has to make about treatment, which can be tough. Physicians don't always give you a green light as to you have to do this or you must do that. A lot of times it's, well, here are your options and you have to make the best decision for you. There are oftentimes no clear-cut, solid ways of going or knowing what way is going to be the best way. And a lot of times it's the lesser of many evils. None of them sound great, so it's choosing the one that maybe is best for that person and their family. It's also thinking about recurrence. What are the chances that I'll get the cancer again? Adjusting to it, emotional issues, and when social support is important. We saw the video last time about Dr. Spiegel and his cancer support groups, and we understand now how important that social support is. Also explain the psychosocial interventions helping to treat cancer, and that is like the psychotherapy. And then we will move into the last segment where we will talk about HIV and AIDS, explaining the difference between those, explaining the risk factors involved in the development of HIV and AIDS, who is at risk, what kinds of things put you at risk. There's a lot of myths here, so don't assume you know. Instead, read and see. Describe the prevalence and incidence of AIDS. Explain how HIV progresses to AIDS. And then describe the typical AIDS treatment regimen and factors affecting adherence to treatment. And here's where that video is really going to come in handy this week, is looking at those individuals who have AIDS or HIV and how they are affected by it. And then understanding the psychosocial impact of AIDS, as well as psychosocial interventions that are used to target AIDS. And while the video was done, I believe in the early 90s, many of those treatments are still primarily being used. We've gotten some additional interventions that have come into play, but all of that is still pretty much the way that it is. And that will wrap up chapter 14.